Hi everyone, welcome back to Easy Ayurveda classes. And today we'll be learning the clinical case discussion on the case called as the dry cough. On the case called as the dry cough, which includes both the allopathic and the Ayurvedic management. And in this case, the patient will be non-smoker cases. Listen carefully, it is non-smoker cases, because for smoker and non-smoker cases the treatment goes different. So it is a basic first one, that is non-smoker cases. So history, patient name is Miss Anjali, 24 years. It has taken just for sample purpose. Complaint, dry cough for 7 days, no fever or no sputum, symptoms worse at the night in cold, no grip or allergy of history, only dry cough is observed since from 7 days, and she is a 24-year-old girl. So, what are the possibility causes? First one will be the viral pharyngitis. Viral pharyngitis, since her voice has been not disturbed. If her voice has been disturbed, then it will be viral laryngitis. Next, post-nasal drip, allergic dry cough. There is no allergy in her because as there was no sorry, account exposure to climatic changes. She has been exposed to climatic change recently, so her dry cough has been introduced. So treatment according to allopathic treatment will be the tablet of the levocetirizine has to be given 5 mg at the night. Only at night it has been prescribed for anti-allergic tablet. Next one is the dextromethorphan syrup, that is 10 ml TID cough suppressant, that has to be given. Otherwise, grill intus. What grill intus? Listen carefully. Grill intus. This can also be given for the dry cough in a patient. Next, steam inhalation 2 to 3 times a day. Next, warm salt water gargles. This is the allopathic treatment. And the Ayurvedic treatment will be diagnosis Vata Kaphaja Kasaha. What is? It is the Vata Kapha predominant dosha Kasaha, and the treatment goes Sitopaladi Churna plus honey 3 grams. What Sitopaladi Churna has to be consumed with the honey. Next, Haridra Kshira at midnight, means for milk. Kshira is milk. For milk, we have to mix the Haridra, that is turmeric, and should be consumed at the bedtime. Next is Eshti Madhu Churna with the warm water. Anutaila Nasya daily has to be done. These three must be recommended, that is Sitopaladi Churna, Haridrakshira at bedtime, and Eshti Madhu Churna with the warm water. This much is indicated for the dry cough in the Ayurvedic treatment. Only this much will be the video for the dry cough, and for the wet cough another video will be done. You can go and check in my playlist, you will get it. Since dry cough and wet cough are two different things, so I'll not combine in same videos, so I'll do make different videos. So if you like my videos, please like, share and subscribe, and please consider this effort for me of doing videos for you, and subscribe to my channel. Thank you.